In research, broadly, there are three approaches that we use. We have talked about it before. Any guesses? Any guesses? What could be these three approaches? We have talked about yesterday, briefly. Sorry? Context is an underlying factor, but it's not an approach. It's how you view, it's a perception. Sorry? Okay. So there are three approaches to doing research, MEL. First one is qualitative approach. Okay? The second one, any guesses? Quantitative, yes. What would be the third one? Any guesses? If I'm saying there are three approaches, two of which is qualitative and quantitative, what could be the third one? Mixed, right? Mixed methods. Okay? This is it. There are three approaches: qualitative, quantitative, and mixed method. So now we are, there are other things to talk about when we talk about research approaches. I don't want to go into that. There are many ways of looking at doing research. For example, if I am working in a tribal population, then I might want to look at a culturally appropriate evaluation design. That is why I need to have a culturally appropriate approach to doing that. If I am talking about, if I want to do a research on, let's say, LGBTQ or transgender community, then my approach to viewing that, the lens, the philosophical assumption that we talk about will be different than the general research that we do. So that's a different kind of an approach, something called philosophical assumptions. In research, you can read about it. We are not going to deep dive into it because that's a 3-day long course in itself. But what we want to focus today here is how we do qualitative approaches in research, quantitative approaches in research, and mixed method approaches in research. Okay, so let's start with qualitative. When you think of qualitative research, what comes into your mind? When you hear, okay, let's do a qualitative research, what comes into your mind? You said context, right? Context comes into your mind. What else comes to your mind? Sorry? Quality? Okay, that's a little farther away, but I'm going to park that for a bit. What else? Data is there in qualitative, quantitative also. The mixed method also has data. People. Right? With people comes perspectives. I will have a different perspective, you will have a different perspective. Perspective. If I have a different perspective, I will also have different understanding of a subject. So there is a subjectivity involved. I am looking at a problem in a different manner. For example, if I am an economist, I will look at numbers and I will interpret the situation from a numbers point of view, or a macroeconomics or a microeconomics point of view. If I am a grassroots worker, if I am an advocate, if I am into advocacy, I will look at a certain phenomena in a different manner. So there is always a subjectivity involved in that. Okay? And one important aspect in qualitative research is society. I'll give you an example. We said, okay, let's pick one of the examples from here. Let's say, let's take an example of hawkers, street hawkers, right? There is a lot of congestion because of street hawkers. There are two ways to looking at it. One, we see, okay, in Police Bazaar, there are XYZ number of hawkers which are creating, who are creating a lot of congestion in the road. That's quantitative way of measuring. There are 10 hawkers situated in this particular location, and because of that, there is traffic congestion. There's no parking. There is, there's no, the footpaths have been kind of captured by them. So we need to relocate them somewhere. This is a quantitative way of saying that 10 hawkers needs to be addressed. When you look at it from a qualitative point of view, then you will say, okay, let's try and understand why these hawkers are here. It's their livelihood. If we remove them from this particular location, what happens to their livelihood? What is the context that they're coming with? Are they? Is there residential places there, and then that's why they're putting up their shops right next to their residences? Or what is the story behind them having these stalls in place, right? So you have to understand the context, the social development or social angle that they bring in, rather than just looking at the fact that, okay, these are causing problems. So that's what they do. So there is a context, we know, but there is, in qualitative research, we always understand people in the context in relation with the society that they function in, and perception of society, perception of society, the subjectivity that is attached to it. We not only look at, okay, problem is the placement of hawkers. Quantitative research oftentimes stops at that. But qualitative research tries to understand, no, there is a problem, yes, we understand there is a problem, they are creating congestion to the road, but let's try and understand why this is happening, where are they coming from. If we remove them from this particular location, what will happen to them, their livelihoods, what are the risks that we are going to, or they are going to face, and what are we going to do about it? So, you have to look at it from a bigger ecological point of view. And that is what qualitative research allows us to do. Okay, so that's one way of, whenever you are conceptualizing assessments, whenever you are conceptualizing evaluations or monitoring, there are two ways of looking at it. One, from a very objective point of view, that yes, this place is not meant for hawkers, we have to remove them. But then there is a qualitative angle coming in, what will happen to them? What are we going to do about them? What about their livelihood? What about their children? What about their residences? What about their schools, right? What about the local infrastructure that they've created? What about their support structure? All of these questions starts popping in your head. So that is why in the recent years, there is a popularity of using both qualitative and quantitative research, and the mixed method approach comes into play. Okay, so right now when we are saying, okay, this is happening, we want to achieve XYZ, we can't only look at it from a purely qualitative point of view or a purely quantitative point of view. You always have to have a mixed methods approach to looking at a certain phenomena, and that is these three are the basic research approaches that we as an evaluator also use. And whenever we talk to donors, whenever we talk to the government, we also try to pitch this idea that, okay, let's not look at it from a very objective point of view or very subjective point of view. We'll see what happens. That's not the way to go. What we do is, we have certain questions that we need to answer. Yes, very objectively, we'll do that in a quantitative fashion. but we also need to be cognizant of the context, the people and their interaction with the society, what they perceive as challenges, risks, what we perceive as challenges and risk for our own program. And to bring that together, we use both qualitative and quantitative approaches. So if you look at the definition of approaches, qualitative research is an approach of exploring and understanding. We are not going with a value judgment. We don't know what is there, what is going to happen. We want to explore. We want to understand. That is the language that we use in qualitative approach, research approach. And the important thing here is meaning that individual ascribe to a social or human problem. Oftentimes we go with our own prejudices that yes, I know better, but it's not the case. Qualitative approach always says that let's hear them out, because my understanding of their placement in that street is very different from why they are selling or they have put up their stalls in the streets, right? Quantitative research, on the other hand, is an approach for testing objective theories by examining the relationship among variables. This is, in a simple way, we are saying we are going with a theory. We have a hypothesis: the traffic condition is caused by placement of these hawkers in a certain location. Now we need to find out whether it is true or false. We always have outcomes in mind. And what we all often do as researchers or evaluator is try to either test that hypothesis to be true or false, right? We are not concerned about, okay, what happens to their livelihoods then. We are saying, okay, we have examined, we went there, we sat with them, spoke to them, collected data, we have statistics, and we say, okay, this is a problem or this is not a problem. It is because of something else. Sorry. Yeah. So here the words to be underlined is objective theories. We always go with a hypothesis or a theory. Now, like I said, the mixed method research is an inquiry involving collecting both quantitative and qualitative data, integrating the two forms of data and using distinct design. I said that, a mixed method uses both qualitative and quantitative. There's another layer to it. When to use qualitative and when to use quantitative, if we are using it together. So there are three ways to do that. The first one is a parallel use. What do we mean by parallel use? We have a structured questionnaire. We know the variables that we want to explore. We have a hypothesis to be measured quantitatively. But we also have a checklist, a qualitative checklist or an open-ended kind of a questionnaire which will help us gather qualitative insight, right? So these two research go hand in hand. It's not like, okay, let's do quantitative first and then we'll see what are the trends emerging, and if we don't have answers, if the number is not going to give us adequate answer, we're going to go and talk to them qualitatively. Here in this first way of operationalizing mixed method research is we do this simultaneously and see what answers we get, inquiring from a qualitative point of view and quantitative point of view. The other one is we go, we first say, okay, there is a problem, there is an underlying problem, let's look at it from a quantitative point of view first. And then based on the quantitative information that we get, if there are any gray areas, we go back to them and try and understand them from a qualitative point of view. That is called sequential. All right. Sequential also has two elements: qual first, quant to follow. Okay. The other one is quant first and qual to follow. Okay. So, couple of things to remember when we talk about research approaches. There are broadly three: quantitative, qualitative, mixed method. Qualitative is when we want to understand how people interact with their society, what are the societal norms and societal norms they ascribe to when they are describing a problem or they're describing a situation. Quantitative research is mostly used when we are trying to test a theory or a hypothesis to prove it false or true. And also it's mostly numbers. And there is a third or mid path, which is use of both mixed qualitative and quantitative, which is called mixed method approach. And within mixed method, we have two broad domains telling us or guiding us how to use both qualitative and quantitative. One is to do parallelly. We start both qualitative data collection and quantitative data collection together or inquiry together. The second is a sequential one. Sequential one, again divided into two. The first one is qual first followed by quant, or quant first followed by qual. So whenever you are whenever you're saying that, okay, I am using mixed method, then you have to define this. Mixed method could be these two, right? So we need to define the design further, saying, okay, I'm going to inquire together parallelly, or I will have a sequential design. Okay, any questions? Any questions, clarifications? Okay, all right. So I'm just going to summarize what we just talked about. In qualitative, we say that reality is socially constructed. Reality is not often what we see. Qualitative research says, okay, this is quantitative research says this is a marker which is black in color and this is a whiteboard marker. But qualitative research can say otherwise. This is a pen, right? For me, this is a pen. The reality is constructed differently. Quantitative social fact have an objective reality. This is a pen, this is a marker, a whiteboard marker, color is black and it is temporary, right? Everything is defined, objectively defined. Primacy of subject. Qualitative puts a lot of emphasis on people. Subject is nothing but people. So people take precedence over data or over methods or over whatever. Here, this is primacy of method. We are going to use this particular method. We are going to use structured tool. We are going to do a sample. We are going to talk to X number of people. The number, the method, it becomes important here. Variables in qualitative research, variables are complex, interwoven and difficult to measure. What does this mean? I am saying this is not a pen, right? This is a stick. Even though you are seeing that this is a pen, qualitative research constructs reality differently. For me, this is not a pen, right? I mean, the discourse around gender. I don't identify myself as a woman or a man. Yeah, so the variables that need to be measured are complex here. But there are so many other, there are methods to make sure that in quantitative, the variables are measured in the way they should be measured. This is a pen, this is a marker. This is a marker and it needs to be erased after I write, right? So this is like something which is existing and proven that it can't work otherwise. In qualitative research, relationship between variables are generally described as observed patterns or cases. I just, for example, I said pen, so I couldn't figure out whether this is a pen or this is a marker, right? In this split of a minute. And the same thing happens here also. Sorry? Yeah, exactly. That's your interaction with the society. This is my interaction with it. I've been holding this pen, a marker, But if I call this pen, pen, pen for the last 10 years, this is a pen for me, this is not a marker. So, yeah. And quantitative research, relationships between variables can be assessed using standard statistics. So, there's a different course altogether on statistics, how we use statistics in data to analyze data in evaluation and monitoring. That is a different subject altogether. But what we are trying to say here is there are set algorithms to test the hypothesis, which may not be true for qualitative research. Okay? So you must, if there are any questions, please feel free to ask, but this is the basic distinction between qualitative and quantitative. Start with people. People are subject for qualitative research. Here, method is, in quantitative research, method takes the primacy. Okay, let's go a little higher. The purpose, what is the purpose of doing qualitative research or approaching a research in a qualitative fashion? One is contextualization. We've talked about contextualization. I don't want to go into that. Interpretation. My interpretation of a certain phenomena is different from yours. I don't believe there is climate change happening, and there's other people who says, okay, climate change is happening. There's different interpretations. Although the first one is stupid, but anyway. Yeah, so the other one is understanding people's perspective. People takes primacy here, and their perspective and their understanding, exploration of their understanding, perception, everything. Sometimes what happens is we often say that, okay, we want to test the effectiveness of the program. We want to test the effectiveness of the program, and there are quantitative and qualitative measures both. But you also say that, today morning only I was presenting a finding to one of the clients. They're saying, okay, I want to talk about whether my program was effective. But they only asked us to do a qualitative research. So what I said was, okay, I would have done a better job if I had a counterfactual to see, okay, whether the program has worked effectively or not. Right now, if you talk about effectiveness to me, if I were to give you examples of effectiveness, I can only see it is perceived effectiveness, because I only spoke to 10 stakeholders. And they think that, from their observation, they think that, okay, this program is working because of these factors. I don't have data, quantitative, numeric data to support it, right? So, what happened here? We try to kind of uncover people's perspective. You have been implementing this project for the last 5 years. You tell me whether it is effective or not. And that person can only tell me his perspective. So that's what qualitative research tries to build. In quantitative research, the findings are usually generalizable, because we are using methods which are pre-validated, which is used across the world. We have algorithms, we have tools, we have statistical softwares to do the analysis for you, which is all validated. So, there are designs, we have sampling designs, we have different kind of designs to maintain a representation, balance in the sample. So that is why there's generalizable findings. There is prediction. All of you must have come across modeling of different kinds. If this is the productivity today, let's do a modeling to see, with the same kind of effort, where are we going to reach after 2 years, after 5 years, right? So there is like a level of prediction that comes with quantitative, that can be done with quantitative data. But qualitative, you don't know. Tomorrow, my perception might change. My understanding of a situation might change. So there is no prediction in qualitative research. There is always a causal explanation. Theory of change we talked about, which has a causal linkage. Theory of change, quantitative data often builds on the theory of change. Qualitative also does. But in the theory of change, assumption can be tested using qualitative methods. But the outcomes, outputs, impact, what we talked about, is often measured using this causal explanation. It's also very important whenever we are choosing an approach, it's also very important to understand the role that I as a researcher play, right? In qualitative research, there is always a personal involvement. That is why qualitative research approach is often critiqued to say it is biased, right? And there are measures to kind of mitigate those biases, but it is true that there is a personal involvement and partiality or certain kind of preconceived notion against a certain phenomena which qualitative research brings. But with that, there's also an empathetic understanding. I am not going to just go and say, okay, these hawkers are creating problems, eliminate them from the streets. No. I am going to say, okay, what are the solutions? What can we do for them? Right? So there's an empathetic understanding of the researcher here. So you approach the problem in a solution-focused manner. In quantitative research, it's often detachment and impartiality. Whenever we do quantitative research, sometimes we just ask our enumerators to go collect data, and then the data will come to us, and then we'll feed it in the statistical softwares, and it'll give us results. But we can't do that when we are doing a qualitative research. I go to the field often when it is when the approach is qualitative approach, because I can't just sit here, ask somebody else to go to the field and debrief me what happened and I write a report. That doesn't happen. I have to be involved. And there is an objective portrayal. What you see is true, what you don't see is false. But in qualitative research, that does not happen. Design, again, if we are looking at designing, qualitative research is very flexible and emergent. Today, I am talking to you about, let's say, mother and child health. But in the middle of it, I find out that you are also facing intimate partner violence. What do I do? Should I just shove it under the carpet? No, then I'll have to think of different strategies, yeah, how to mitigate those challenges. How does that impact my maternal and child outcomes? These are some of the emergent themes that that come from the field, the realities, and the design also has to be agile enough to consider all of that when we are presenting the findings, etc. Design often in quantitative research is a priori. Once you are set, we are saying, okay, we are going to do XYZ design. It is going to be set at stone. No force in the world can change the design once the data is collected. Okay? Yeah, so this is the last slide in approaches. So qualitative approach always ends with a hypothesis and a theory. But quantitative begins with a hypothesis. We already have a hypothesis in mind. I think that the scarcity of water is because of the construction of a building in a particular water source. That's my hypothesis. Right? The quantitative research always has a hypothesis. We have to just prove and disprove that. But qualitatively speaking, I will say, okay, when there is scarcity of water, when did it start? What was the reason? Let's not jump into conclusion. Let's find out whether this is because of a infrastructure development project, or whether this is man-made, or whether this is climate-driven. So, you know, and at the end of the day, when we have all the data, then we create hypotheses and we create theories. Emergent, I already talked about qualitative approach being emergent. And quantitative, you can always control, manipulate or control. There are, I mean, this is another statistical word that we use in quantitative research, controlling for other variables. Right, so that's something that is there. It's basically data, numbers, we crunch them and we control for XYZ factors and then present our data. In qualitative, it is naturalistic, it is empathetic. We talked about being empathetic towards the subject, and it is naturalistic. It is in quantitative is an experimentation, yes or no, disprove, prove. It is in qualitative research, we do induction. We try to understand what happened rather than saying, okay, this is the result, let's try and deduct the causes for it, right? In qualitative research, it searches for patterns. It's a component analysis. Patterns could vary. It could be X, Y, Z, A, B, C. Here we know that we are only dealing with X, Y, Z. There is no A, B, C in that. Qualitative research seeks complexity, pluralism. If there is a complex phenomena, there's a word, emergent word in evaluation. It is called complex evaluation or complicated evaluations. Those kind of evaluation often uses mixed method, and there's a lot of emphasis on seeking pluralism, intersectionalities, and complexity. Right now, what is happening in the development sector is, if I talk about education, I can't talk about education without talking about gender. I can't talk about gender without talking about livelihoods. I can't talk about livelihoods without talking about climate change. I can't talk about climate change without talking about agriculture. So there is a lot of complexity that is coming into play, and qualitative research helps understand that complexity, right? There's not much use of numerical indices. It's more narrative based, more data in the form of non-numerics, and this one is all numerical data. That is the basic kind of a difference that we see in quantitative and qualitative. Okay, so if you know this, you will be able to better understand which approach would be most suited to your study, your research, your evaluation monitoring. So this is it for approach and approaches of doing research. Any questions so far? Okay, we'll move on to the next topic if you don't have any questions, but if you have, please feel free to jump in whenever. We are narrowing our focus down. We talked about research in general. We talked about project. Where does M&E fall in the project cycle? What is the need for MEL? And we talked about having a theory of change. We talked about having results framework. Then we talked about designing our research using different approaches. Now we jump into one particular aspect of evaluation, which is called impact evaluation. What is impact? We have been talking about impact in the last 2 days now. What is impact? Sorry? Results, yes. To further this a little bit, simply the change in the result. And change could be positive, change could be negative, right? When we think of impact, let's not think about impact as a positive nomenclature only. Impact could also be negative, right? The other thing, this is both positive and negative. The other thing is this change in result could be intended or unintended. When we develop a theory of change, we always talk about intended impact. Most of the times we talk about intended impact. We want to better the lives of the people, lives and livelihoods of the people. We want to see increase in productivity of certain crops. We want to see improvement in the income of people. We want to reduce gender-based violence. We want to, we want to reduce absenteeism in school. We want to improve the literacy of the students, right? There are always predefined results area, which is intended and which is explicitly mentioned in your theory of change. This is what my program intends to do. But there are often changes which are unintended. Why? Why do unintended change happen? Simple answer, life. Life happens, right? You are working in two districts where your program is being implemented or your project has been implemented, but you are not the only one working there. If you are working in health domain, there is education, there is other government schemes that's working there, there are people, there are other schemes that are working there. There are people who are in general being aware of a lot of other things, which leads to changes and which leads to unintended outcomes or unintended results. So whenever we talk about impact evaluation, we have to be careful, we have to be cognizant of the fact that yes, there is an intended results area which your program intends to achieve, but there is a likelihood that you see unintended results as well. For example, I'll give you an example. What happened in one of my projects is they wanted to, it was a school meal program in Nepal. I was working in Nepal in a school meal program. So their objective, the intended outcome was to improve attendance in school because of the school meal program. They used to give lunch to students till grade 5 so that they are, they stay in this classroom longer. After lunch also they stay back, they don't go home and then don't return. So retention in classroom was one of the intended objective that they wanted to achieve. What happened was, because of that, because the students are coming to school, the mothers' livelihoods got better because they don't have to take care of the children when they are at home now. The program didn't intend to do that. But since students are coming to school, what happened? The mothers got to go to work. They got to earn more income. Their livelihood flourished. So that is what is the unintended income. Just because you are creating certain certain conditions, that will result in intended, but there are also unintended results because of that. Yeah. In other, so these are, two kinds of, if you are decoding impact, these are some of the things that you need to take care of. There is something called BAU. What is BAU? We use that quite often though. It's business as usual. Right? It's BAU is business as usual. Sometimes because of program intensity or because your project is not implemented in the way it should be, or because your money got over just in between, there are so many factors which hampers your implementation, or your program was very well planned, but somehow there were contextual factors in play, social political factors in play, which did not result in increase or any change in your result. For example, if you are implementing a 5-year program in health or education, let's say, and you wanted to improve literacy levels of students, right? But after 5 years, you saw that in grade 2, 30% of the students were able to read the grade level text. And you look at the baseline figures, but you see that there's not much change that has happened. Earlier also it was 40%, now also there's 40%. Something went wrong, right? So you see there is no change. Or you see an increment which is not, for example, you wanted to achieve 40%, you only achieve, let's say, 15%. This is business as usual. Even if you had not done anything, even if you had not had any kind of implementation or activity to improve literacy rates, This anyway was changing because of different changing scenarios. People are becoming more aware that they should send their students to, send their children to study and all that. So without any intervention, this is business as usual is without any intervention, you are seeing some change, but you are seeing no change because of the program. How do we calculate that? That's the next thing that we're going to talk about, right? Here, I mean, and there's negative impact. Negative impact is you had 40% and then now after 3 years, this is 30%. So there is a decline of 10 percentage point here. So negative impact is very clear. But let's understand business as usual scenario versus change that has been brought about by the program. And that is the primary purpose of doing an impact evaluation. Okay? Okay, let's see. There's this school. Okay? There are students here. I'm very bad at drawing, so. Okay? Now there is my program. Okay? And there is also world, life, which is happening. Now, my program wants to bring more students to the school. World is anyway also sending their children, or let's say families, they're sending their children to school. How do I know that the addition, for example, this was the initial cohort. Now, there are 4 more children who are enrolled. How do I know it is because of my program or it is because of business as usual? How do I know that? To know that, we do impact evaluation. Okay, I'll show you a figure. Here, do you see this? This is 5 years back. 5 years pre-intervention scenario. We were here. Now, if you follow this, we are here. But there is a interjection in between, and there are 2 lines coming out of this intersection. This is usual, this is pre-scenario. Where baseline happens. This is where the baseline, yesterday we talked about where does baseline happen? Baseline happen here, because program is starting here, right? So we do a baseline and figure out that, okay, our variable of interest, our primary outcome is right here. Let's say this is 15% at present. We track the change over time, go all the way to impact. But there is another line as well. We know that we have reached here. The yellow is the pathway that we are following. But there is also another pathway which is nothing but this, the usual business as usual scenario. The world is anyway moving upwards, but because of the program, we see a higher traction here. So what impact evaluation does is it helps understand what is the difference between this and this. Okay? So, your question on assessment and evaluation. Assessment will help us understand what happened from here to here. Has there been a change from 15% to 30% or whatever? Evaluation help us establish the difference that you see from baseline to end line in comparison to business as usual. Okay? And in evaluation term, we call this counterfactual. Counterfactual or comparison. Have you heard about treatment control, treatment comparison before? No? Okay. So evaluation's primary task is to look at what is the incremental change that the program brings about in comparison to business as usual. Okay? And now I threw a lot of jargons. Well, let's decode those jargons. Incremental change. That is, what has been the impact of my program on the result? My program. I'm not talking about the world, the rest of the world. The rest of the world is also doing good things. But I want to know what happened because of my program, of my investment, my effort. That is incremental change. Measured against business as usual. Okay? The second thing to talk about here is something called counterfactual. Counterfactual helps us establish incremental change. It tells us whether there has been an incremental change or not. Okay? Now, what is counterfactual? Have you heard about randomized control trials? RCTs? Right? Let's talk about RCT in its conventional form. In medicine, what they do is they bring two rats, right? One rat is given some treatment, some medication, some drug, some etc., and the other rat is just given a placebo. They're not given any kind of treatment, any kind of medicine, any kind of intervention. Those two are called a treatment mouse and a control mouse. Okay, treatment mouse and a control mouse. And we see if I am giving drug to one mouse and I am not giving drug to one mouse, what is the result going to be? In a very health, medical, randomized experimental design, this is how treatment and control is defined. Humans can't be mouses or mices or whatever, right? So we can't have a control. I mean, in some scenarios, early on when the development world was kind of evolving, in initial phases, there were a lot of randomized control trials that happened. They used to select a geography where they used to provide intervention support. They will, put people. They will try to increase awareness of the population there, and they will not do anything in the other geographies. So, and they used to control for other things. They also control for the fact that, okay, in this geography, there should be no other partners talking about the same things. There should be no intervention, no exposure of any kind to any of the elements that has been, happening in the treatment or the project geographies, right? But now the world has changed. You can't control. If you look at Bihar and UP, I don't know about Meghalaya. If you look at Bihar and UP, one block will have 5 different partners investing money, pumping their money, right? Because they want to bring about this change, this change, this change. So one person, if I am an individual in a household, I'll be receiving 5 schemes, right? So I can't disaggregate, okay, this person is going to get something, this person is not going to get something. So there's always something or the other happening. That is why we use the term comparison. We can't control for all of these factors. We can't say, okay, I am DFID, I am going to invest in these geographies. You are not allowed. You can't say that. It's a very touchy subject. You can't just throw other partners out. So what you do is you coexist with them and say, okay, I want to see the result of my program in comparison to others, but not control for other things. I can't control how other people or the organization work. So in evaluation, at present, we use the term comparison, not control. And comparison is another word for counterfactual. Right? This is a more technical term, counterfactual or comparison. right? One key factor, so this is like one intra, let's say there's an intra geography thing which is happening. This is also, there's another called intra geography, let's say. We talked about multiple partners working in the same geography. Let's call that intra geography. There's also inter-geography, where we're saying that in Meghalaya, there are 5 districts who's been looked after by X partner, and there are 5 districts who's looked after by Y partners. So there is a distinct kind of a difference between these two. That so what we do is the basic principle is that if your project is here, you find a comparison or counterfactual here. Okay, where this is your project geography, this is your comparison geography. But one of the things that you need to take care of whenever you are kind of looking at counterfactual is that the characteristics of this project geography, the subject in the project geography, has to match with the comparison geography. I'll give you a simple example. I don't know about Meghalaya context, but let's talk about my home state, my hometown. I'm not aware about states also, but I'm from Kalimpong. It's in the Darjeeling, you know the Darjeeling, Sikkim, Kurseong, Kalimpong. So I'm from that particular area. If I were to do impact evaluation, and it is in the it comes in the West Bengal state, right? State of West Bengal. I can't compare Kalimpong to Calcutta, although they are in the same state. Why? Because the socio-economic political characteristic does not match. So I have to find a counterfactual or a comparison either within Kalimpong, if my program does not cover all of the Kalimpong, or have to find similar characteristics, people of similar characteristic elsewhere. For example, Sikkim, we speak the same language, right? I mean, that's one of the characteristics that. Or I have to find a geography which shares a similar statistics when it comes to literacy, when it comes to SC/ST population, when it comes to male-female ratio, when it comes to access to government skills, government schemes. So these are some of the variables that I need to pre-identify to match my project areas to comparison areas. If this matching is not strong, then we can't have an impact evaluation which will tell you about incremental change. Then it is only going to be project. Then what we will look at is, if in absence of counterfactual, this blue line, this yellow line, the other upper yellow line, this is the impact, the red arrow is the incremental change. We won't be able to look at this incremental change in absence of a counterfactual. In that case, what we do is an assessment again of what happened in the baseline to what happened at the end line. But we will not be able to tell the client, tell the donor that this change that the program sees from baseline to end line is because of my program. There is just change from X to Y. Impact evaluation with counterfactual tells you that this change has happened and this change is because of my program. If you don't have a counterfactual to compare, then you will not be able to tell whether that change is incremental and it is because of the program. Okay, so that's the basic difference between assessment and evaluation. Evaluation most of the times has a comparison or a counterfactual. Right? So your design takes into consideration, counterfactual. So there, like I said, you have to match your geographies, certain characteristics prior to collecting data, your sample, your design, everything. So in this case, the impact evaluation design would be there is something called quasi-experimental. Yeah, see? The nomenclature that we used is quasi-experimental or experimental. Experimental has treatment control, quasi-experimental has treatment comparison. It uses counterfactual to estimate the difference. This difference is nothing but this difference, business as usual versus your project difference, right? Key principle is about choosing similar groups. You can't compare people in Kalimpong to people in Kolkata. They are two different people. You have to find similar groups to make comparison. And then you always need to have a baseline follow up with an end line. If we don't have a baseline, we will not be able to see change from baseline to end line, right? We will only be able to see this change if there is a counterfactual. So there are several impact evaluation design. One is this. I'll write that down. This is also called pre-post. This is pre, this is post with project quasi-experimental has these four things. It has a baseline, which is pre, it has a end line, which is post, and it has project and a comparison area, right? So the change here, what is the percentage change between baseline and end line? What is the percentage difference between project and comparison? You can see, right? Now, let's say baseline has a change, a baseline figure is 10%. At the baseline, this is the scenario. When I was about to start my project, education literacy was, let's say, 10%. By the end line, I see there is a change of, I see the literacy rate is at 30%. Okay? Now, project has a change of 30%, like I said, this one post, but comparison has a change of 10 to 15%. Right? There are two things here. One, pre-post, yes, we see a change of 20 percentage point, right? 20 percentage point here, 20 percentage point here in the project. But business as usual is 15%. Even if we didn't have project, so there would be a change of 5% from 10% to 15%. So ideally what we can say is we have to reduce this 5%, subtract 30 and 5, the actual change would be 25% because of the program. That is incremental change. This is the incremental change that we are talking about. If you look at it there, if we have a figure like that, this is where the program is starting, this one, this is 10%, this is 30%, this is 15%. The incremental change that we are seeing is 15, 10, 25%. The actual change because of the program is 25%. Yeah? So this is the crux of quasi-experimental research. This is one kind of impact evaluation that we design. Now, second part. If we don't have a, let's say we don't have baseline. Right? What happens then? What happens if we don't have a baseline? is something called ex post evaluation, where we will have a project, we'll have a comparison. We see project is at 30% and comparison is at 25%. Right? What is the difference here? Right? Because this is the actual change that the project is able to bring about. We already see a 25% here, business as usual. Comparison is business as usual. So what we do, we divide these and we see, because of my project, we don't know what happened in the baseline, but right now at this point in time, the change is at 5%. Okay. Now there is another scenario which is called pre-post. Sometimes what happens is we are not able to find a comparison. Okay. What we do then, we simply say, we go to both the we do a baseline. 10% is was the status in baseline, and in post this is pre. See, this is 25%. So we see a change of 15% here. This is third type of impact evaluation, of doing an evaluation. This is without counterfactual. This is just pre and post. Okay, and these are all quantitative measures. There are also qualitative measures to doing impact evaluations. Process evaluation we talked about, which is mostly focused, it mostly uses qualitative means of doing impact evaluation. That's there. How many types of impact evaluation designs we talked about? We talked about quasi-experimental design, which is the most used design in impact evaluations as of now in today's market. We talked about ex post evaluation, where there is no baseline. Oftentimes it happens that people forget to do a baseline, which is really stupid. Don't do that. You should always have a baseline for your own sake, to understand what happened after you intervened, what happened after your project was put in place, right? You want to see the result, what you've achieved. So it's always good to have a baseline. Even if there is no counterfactual, it's always good to have a baseline. You'll at least see what the movement, negative or positive. So it's very crucial to always start your project with a baseline, right? That's the second kind of thing. The third is what we call as pre-post. No counterfactual, because you're not able to get counterfactual. Everything is contaminated. We use the word contamination in research, where we are saying that there are so many other factors that come into play and we can't control for them. We can't tell other donors to just go away, right? They must be doing the same thing as you. So we're not able to find a counterfactual or a comparison. So what we do is simply do baseline and endline. That is called pre and post. So three kinds of design we talked about: quasi-experimental, ex post, and pre-post. Okay, if you know this, then you know half of the impact evaluation designs. It mostly revolves around these three. There is another one you must have heard about. It's called longitudinal design. Anyone heard about longitudinal impact evaluations? That's the fourth one, which is commonly used. What does longitudinal mean? It simply means that in the baseline, if I am talking to, or if my intervention is focused on these four individuals here, I will track these four individuals over the last over 5 years, over 3 years, over the duration of the project. That is longitudinal design. So let's talk about what do we get out of doing evaluations, right? There are three ways to look at the outcomes of the evaluation, like this one's summative or outcome evaluation. I mean, don't read all of this. This is like a lot of blabber there, but just look at this summative or outcome evaluation. This evaluation, this kind of evaluation often focuses on the outcome that the project wants to achieve. Summative means we are summarizing what happened in the domains we pre-identified. Alright, we said that we are going to achieve a change of 15% in women's literacy. Did we achieve that or not? That is summative. As simple as that. Okay? Whether the outcome has been achieved or not, as per what we defined when we were designing the project. Now, formative and diagnostic evaluation. What is this? I mean, it mostly uses principles of process evaluation. We have to design a different kind of evaluation for this. But most often what happens is, we talked about unintended outcomes as well, right? We see that, okay, we intended to make lives of women or livelihoods of women better, but we ended up seeing better result in dietary diversity. That was not intended. What happened there? So we do a formative or diagnostic evaluation following summative or outcome evaluation. Right? So that is another kind of, if you want to achieve, look at, outliers. We call outliers in a program. We have a result. We see 10 out of 8 people saying the same thing, but there will always be 2 people who has different result. So we want to deep dive into this and see, okay, what are the reasons for it? So we do a diagnostic assessment, evaluations. So these are something, that can be done through evaluations as well. And there are system focused evaluations, and more you will hear whenever you are talking about monitoring and evaluation, that evaluation needs to be theory based. That is why we put a lot of emphasis, we did this exercise of theory of change, because most of the times evaluations rely on program theory. And there is this whole thing about theory based evaluations that basically says that, okay, let's follow each of these things. Let's follow input, activity, output, outcomes and impact, and see whether this logic holds true or not. A. Second, are there any loopholes that's there? So all of these things in theory based evaluation, there are several designs, several methodologies that can be used, like we have said, realist evaluation, contribution analysis, outcome harvesting. These are all, I'm just throwing nomenclatures here, you can read about it later, but we can, through evaluations, we can also look at what happened across the theory of change. Okay, so these are some of the things that, this is basically the objective of doing an evaluation. You either want to sum up your result and see whether you have achieved the envisaged results or not. You want to look at if there are unintended outcomes or outliers, what's making that result happen. That's why you do a formative or diagnostic evaluation. Sometimes you also want to go through the entire theory of change and see, okay, what happened? What processes were put in place? What our processes, what did our strategy work better in this context or that context? You test assumptions. If we did not get, or if you're not able to get to the intended results, what is the problem there? So what we do is, like, we look at outcome harvesting, we do contribution analysis. Realist evaluation says that, okay, my program worked, but for whom? In what context? And what worked for them? So you kind of, narrow your focus down rather than just saying, okay, whether it has worked or not. So these are some of the ways to utilize your evaluation. Okay, you can take notes of these nomenclatures and read later on. Okay, we move on to another topic if there are no further questions. How many of you have heard this word, DAC? How many of you have heard the word OECD? No? Okay, you've heard. We have a winner. What do you know about OECD, DAC? What do you remember? I remember a bunch of old guys back in 1990s talking about impact evaluation and still troubling us with DAC. Do you remember the same things or different things? Sorry? Different one. Okay. One. Why don't you share? It's not related. Okay. No. But I'm curious now. What do you? I'm yeah, seriously curious. Is it like something which will lighten up the group, or please? No, you don't want to share? Okay. Okay. So in 1991, there was a group of people who first coined this term called development, from this thing called committee called Development Assistance Committee. That is, this is called development, developed by this organization called Organization for Economic Cooperation and Development. I had to see because I don't know the full form as well. So it's called Organization for Economic Cooperation and Development. Okay, so there was this bunch of people, mostly economists. They said, okay, let's working with this Organization for Economic Cooperation and Development. They said, okay, let's come up with some evaluation criteria, which is called through Development Assistance Committee, which has like different components which the evaluation looks at. So right now in the earlier session we talked about impact. So this bunch of guys, they just sat together one nice evening and said, okay, impact is not enough. We have to look at other things as well. We have to look at other domains that my program or my intervention might be able to contribute towards, right? So they came up with something called DAC criteria for evaluation. Okay, so we talked about impact. So initially there were 5 criteria which we will talk about. And just a context to this, even though we're talking about these criteria today in today's session, the world has moved beyond DAC criteria. But it is important for all of us evaluators to know what are DAC criteria. That's why we are doing this session. But the world of evaluation has now moved on from DAC criteria and looking at smaller aspect of impact and they are using other criteria as well. But it is important for us to know what these criteria mean. The first and the common one, the first criteria that they wanted to evaluate was relevance. Okay, forget impact. Let's talk about relevance of the program. So the first one is relevance. What does relevance mean? Is the intervention doing the right thing? Is the intervention relevant in my context? Are we doing the right thing? That is the basic question they are asking through this evaluation criteria. Okay. Is this program relevant to my context? We are talking about drinking sanitation, water sanitation facility. We are talking about a natural resource management program in a setup where there are there's no contextual variables that actually leads to doing a natural resource management program. Is it relevant in my context? No. There are only buildings. You can't do a natural resource management program in Gurgaon where there are only buildings, no trees, nothing, right? So what I'm asking is my program relevant? Through my evaluation, I also want to know, I don't want to know, I mean, I want to know the impact, yes, of course, but I want to know, are we doing the right thing in the right context, right? Second, coherence. What does coherence mean? We developed theories of change, and we said that in order for us to reach to a certain result, we need to do certain activities which correspond to the result, right? We can't go about doing market linkages when there is a need for an education program. So my program, my activities and my result needs to be coherent to each other. So there is two elements. One is internal coherence, and the other one is external coherence. How well does the intervention fit? I am doing a behavior, I want to see behavior change in people, but I am going to give them one training. Will that suffice? It's not coherent. You need to have a continued effort to building that behavior, right? Only then you will be able to reach that behavior change. One training is not going to help, right? So whether the intervention fits well in correspondence to the result, that is what we are looking at. Now, internal and external. Here we talk about SDGs and we talk about all the government priorities. We'll talk about central schemes and all that. That is where the internal and external coherence component come in. Internal is my program, my stakeholders. Am I employing the right set of people, right expertise to look at the intervention? That is internal coherence. External coherence is whether my priority matches with the government priority, whether my priority contributes to the larger goal of SDGs, for example, right? So there's an element of internal coherence, whether I have the right fit in my team to be working in this project, internal. External is whether this program that I am doing on education corresponds or contributes to the larger program, SDG, which is inclusive education and growth, right? So it has to have, evaluations are done to look at both internal as well as external coherence. So the word to be highlighted here is fit. Here it is right. Am I doing the right thing? If I'm doing the right thing, does it fit? Does my intervention fit in the context? This is the second DAC criteria. The third one is, we talked about this, is effectiveness. The activities that I plan is effective in reaching to my goal. That is the basic area of inquiry that I have under this. There's the other one, this is the third one. The fourth one is efficiency. This is nothing but cost per case. We often do a cost efficiency analysis here. If I'm spending 10 rupees, what is the return of investment I'm getting? Or how my program, for example, this is my program, which is spending $200 per case, but there is other program of similar nature, same program, which is giving me $150 per case, which is more efficient. The 151, right? You are doing the same things here. You're doing the similar activities, everything similar. But this program is giving me a higher cost ratio. This one is giving me a lower cost ratio. And this is more efficient. There are technical methodologies to do this, but this is another criteria that DAC kind of focuses on. How well are the resources being used? So that's the question. How well are the resources being used? Okay, the fifth one is impact. We already talked about impact, so I'm not going to talk about impact. Whether my project has been able to achieve the change that I wanted to achieve, right? That's the fourth one. This is incremental change we talked about. In other words, it is called, you'll hear about it. In other words, it's called attribution. I'm just putting out the word out here. Sometimes you'll hear incremental change, or sometimes you'll hear attribution, right? Now, what is the change because of my program? Not business as usual. Beyond business as usual, what's the impact because of my program? And the last one is sustainability. There are two ways to look at sustainability. One is impact sustainability or result sustainability. The other is institutional or intervention sustainability. When we say sustainability, impact sustainability or result sustainability, we say, okay, in 2023, we see X percentage change happen since 2020. In last 3 years, this has happened. Will the change remain constant if there is no program? Will the change see the similar traction that it saw from 2020 to 2023 or not? If I drop down, if my program is to end today, the impact that I created, is it going to carry forward without my support, right? Did I make that impact sustainable or not? The other is, if I want to scale up, okay, I've demonstrated good results in 2 districts. Now I want to scale this up in another 10 districts, right? Is my intervention suitable to go to that district, scale up, and then also have similar result? So this is something that we do when we do sustainability evaluation. Look at 2 domains, result sustainability as well as intervention or institutional sustainability. Okay, so these 5 criteria are the criteria which these old guys of World Bank and IMF and all of these people came up with in 1991. They did a revamp of these criteria and added 2 more, which is called timeliness. That's another criteria that they came up with. Okay, timeliness. Are results being in a timely manner? I'll give you an example of one of my projects. So we have this health and nutrition project, and they are rolling out modules of behavior change communication on maternal maternal and child health, as well as maternal and child nutrition. And that in the entire module, there are supposed to be 5 modules to be rolled out in a span of 3 years. It's a 36-month project, a 3-year project. We are already done with 2 years of the project, but we are not able to roll out 5 modules. Of the 5, we are only able to roll out 1. So our evaluation will focus on this question: are the results being achieved in a timely manner? In our case, no. We had 3 years to implement 5 modules of behavior change communication, but in 2 years we have only been able to do 1. Is my program intervention timely? No, it is not. Right? So that's the basic question that we seek to answer. Oh, we talked about coherence, yeah. So yeah, there are 1, 2, 3, 4, 5, 6 criteria of 6 OECD DAC criteria. Yeah. What was the first one? First one was relevance. What's the second one? Coherence. Coherence has 2 components. What are those? Internal coherence and external coherence. What's the third one? Effectiveness or efficiency? Effectiveness, right? Whether my strategies are effective to bring about the change that I want to see. Efficiency is what? Cost efficiency. Whether my strategies are cost efficient. And what's the other one? The next? Impact. We already know impact. What is the incremental or attributional change that my program has brought about in comparison to business as usual? Okay. What's the fifth one? Sustainability. Sustainability has 2 components. What are those? Impact or result sustainability and institutional or intervention sustainability. Okay? So when you look at sustainability, when you talk about sustainability, it's important to talk about both these things. What's the last one? Timeliness. Whether my results are achieved in a timely fashion. Okay? So when you say DAC, OECD DAC criteria, these 6 things has to pop in your head. Now you know. Okay? And more in my experience, government still uses these DAC criteria. So the RFPs, that the terms of references that we receive for evaluation, 100% of them will have DAC criteria. They want us to evaluate them based on these 6 criteria, right? So I think this is something which might be crucial for all of you as well. Yeah.